Introduction. Unveiling spinal cord hemisection. A spinal cord hemisection, often referred to as Brown-Séquard syndrome, is a significant injury where one half of the spinal cord is damaged, while the other remains relatively intact. This condition leads to a complex assortment of symptoms, as the spinal cord is a crucial pathway for nerve signals that control our body's movements and sensations. Understanding this condition is vital because it affects not only the physical capabilities of a person, but also their sensory experiences, which are pivotal in interacting with the environment. Spinal cord injuries can arise from various incidents such as vehicular accidents, falls, or violent attacks. Among these, hemisection is particularly intriguing because of its unique impact on the body's two halves. One might imagine the spinal cord as a two-lane highway where information from the brain travels down to the body and sensory information from the body travels back to the brain. In the case of hemisection, this pathway is disrupted, but only on one side, leading to a disjointed communication between the brain and body. The effects of this disruption are profound. The side of the body corresponding to the injury may experience severe motor and sensory deficits, while the other side might function more normally. This stark contrast creates a complex medical puzzle that challenges both patients and healthcare providers. It's akin to having one foot in two different worlds, where one is numb and the other feels every sensation acutely. Understanding spinal cord hemisection not only helps in medical intervention, but also aids in appreciating the resilience of those who live with this condition. The journey of adapting to such a life-altering change involves not just physical adjustments, but also immense psychological resilience and support. Exploring sensory deficits. Sensory deficits in spinal cord hemisection manifest uniquely due to the partial nature of the injury. Typically, the individual experiences a loss of pain and temperature sensation on the opposite side of the body from where the injury occurred. This happens because the pathways that carry these sensations cross over to the opposite side of the spinal cord shortly after entering the backbone. Imagine pouring hot water on one hand, but only feeling it on the other. This bizarre sensation is a daily reality for those with hemisection. Conversely, the same side of the body as the injury retains touch and proprioception, the ability to sense the position and movement of one's limbs. This means that while a person may not feel pain on one side, they can still perceive touch and understand where their limbs are in space without looking. This dissonant sensory experience can be disorienting and requires a significant period of adjustment. The impact of these sensory deficits extends beyond physical sensations. For instance, the inability to feel pain might sound like a superpower, but it is fraught with dangers. Pain is a critical warning system that helps prevent harm by alerting us to potential injuries. Without this sensation, individuals are at a higher risk of burns, cuts, and other injuries without even realizing it. To cope with these deficits, individuals often rely heavily on their visual and intact sensory inputs. This adaptive mechanism requires constant vigilance and can lead to mental fatigue. The world becomes a place where every step must be watched and every touch inspected, transforming simple daily activities into exhaustive tasks. Understanding motor deficits. Motor deficits in spinal cord hemisection primarily affect the side of the body where the injury has occurred. This results in varying degrees of paralysis and muscle weakness, fundamentally altering how individuals manage basic movements and tasks. The muscles may not only be weaker, but could also exhibit spasticity, an abnormal increase in muscle stiffness and involuntary spasms. This makes coordinated movements difficult and often painful. Imagine the challenge of waking up each morning and needing to relearn how to balance or walk with limbs that do not fully respond to your commands. This is the stark reality for those dealing with hemisection-induced motor deficits. Activities that were once performed without thought, like walking, dressing, or even sitting upright, now require considerable effort and often assistance. Rehabilitation plays a crucial role in managing these motor deficits. Through physical therapy, individuals can regain some muscle function and learn new ways to perform tasks. The therapy focuses not just on physical strength, but also on neurological recovery, as the brain and the remaining functional parts of the spinal cord learn to compensate for the damaged areas. Moreover, adaptive technologies, such as braces or motorized wheelchairs, become vital tools in the lives of those affected. These devices do not just assist in mobility, they restore a degree of independence and dignity to the individuals, enabling them to navigate their environments more effectively. The journey through rehabilitation is long and fraught with challenges, but it is also filled with small victories that mark significant milestones in regaining autonomy. Living with spinal cord hemisection involves more than just dealing with physical impairments. It encompasses a broad spectrum of emotional and psychological challenges. The sudden change in one's physical abilities can lead to a profound sense of loss and grief. Many individuals go through stages similar to mourning, as they come to terms with the loss of their former physical self. This emotional journey can be as painful as the physical one, and requires just as much support and understanding. To illustrate, consider the story of John, a young athlete who suffered a spinal cord hemisection during a rugby match. Before his injury, John was an active individual who thrived on physical challenges. Post-injury, not only did he have to cope with severe motor and sensory deficits, but he also had to redefine his identity without the physical capabilities that once defined him. Through therapy, both physical and psychological, John learned to focus on his abilities rather than his limitations, slowly rebuilding his life around new interests and goals. Support systems play a crucial role in this adaptation process. Family, friends, healthcare providers, and community resources form a network of support that helps individuals navigate their new reality. Emotional support is particularly vital, as it provides a secure environment where feelings of frustration, anger, and sadness can be expressed and addressed. Moreover, adaptive sports and hobbies can offer both physical benefits and psychological relief. Engaging in activities that are tailored to their abilities allows individuals to experience joy and achievement, which are essential for mental health. Whether it's wheelchair basketball or adaptive painting classes, these activities provide a sense of community and normalcy in a life that has been irrevocably changed. Understanding spinal cord hemisection is crucial not only for medical professionals, but also for society at large. Awareness of the specific challenges faced by individuals with this condition fosters empathy and encourages support, both at a personal and institutional level. Recognizing the profound impacts of such injuries on a person's life can lead to better resources, research, and rehabilitation practices that are tailored to their needs. The discussion of sensory and motor deficits along with real-life examples highlights the complexity of living with spinal cord hemisection. It is a condition that affects every aspect of life, from physical capabilities to emotional well-being. However, with the right support and adaptive strategies, individuals can lead fulfilling lives, finding new paths and possibilities in the face of adversity. Ultimately, the resilience shown by those who live with spinal cord hemisection and similar conditions is a powerful reminder of the human spirit's capacity to adapt and overcome. It underscores the necessity for a compassionate and supportive community that recognizes the value and potential of every individual, regardless of their physical limitations.